My name is Bryn Hunt. I'm here to talk about HIPAA and mobile devices. To start off, show of hands, how many of you have a smartphone, tablet, and or some sort of mobile device that you use daily for your work purposes? Okay, so the prevalence of smartphones and tablets in our society has inevitably led to the integration of these devices in the world of healthcare. They're too convenient and too powerful for you to ignore. Privacy and security issues in this area have always been a significant concern, but it seems that we've recently seen a tipping point where hospitals and health systems are perhaps not embracing, but at least allowing physicians to use these in the hospital practice. If you don't have a mobile device policy, you need one. If you still have a mobile device policy that has one rule, that physicians cannot use them, you're in need of an update because, trust me, they're using them. According to a HIMSS survey conducted in 2012, over 90% of physicians are using mobile devices in their day-to-day practice. 80% of these are using them regularly to provide patient care. The number one identified use was viewing patient information. They're texting each other about cases, they're taking pictures and sending them to someone for a second opinion. They're downloading medical apps to help themselves provide patient advice and care, all of those different things. So to protect the privacy and security of the PHI that your organization houses, you need to keep up with this pace. Obviously, many HIPAA privacy and security requirements apply to and impact the use of these mobile devices. So how do we allow to keep up with the technology and also comply with HIPAA? In December of 2012, the Office of Civil Rights, in conjunction with the Office of National Coordinator for Health IT, developed a new educational initiative titled Mobile Devices, Know the Risks, Take the Steps, Protect and Secure Health Information. This initiative offers healthcare providers, organizations, and physicians with guidance to help use mobile apps in everyday practice. I brought along with me some of the handouts that they have. You can have these in your organization for the physicians, and they're very helpful. One of the best things that they did was they developed a 5-step process for policy development for organizations. Keep in mind, you're going to need a policy for both medical staff and for your workforce because doctors are primarily the concern, but you also have staff and management that need to know how to work around mobile devices. We believe you absolutely need to cover all 5 of these issues when developing policy in regards to mobile devices. So, number 1, decide whether mobile devices will be used to access, receive, transmit, or store patients' health information or used as part of your organization's electronic health record system. Number 2, assess how mobile devices affect the risks, threats, and vulnerabilities to health information your organization holds. To do this, you need to conduct a risk assessment regarding mobile devices. Identify and address the risks, such as lost and stolen devices, unsecured networks, viruses, malware, all the different things that affect mobile devices. It should include reviewing risks created by all mobile devices used, no matter whether the organization purchased them or they are purchased by the physicians themselves. We recommend that you perform a risk analysis periodically and whenever a new mobile device becomes available for physicians to use. Number 3, identify your organization's mobile device risk management strategy, including privacy and security requirements. Number 4, develop, document, and implement the organization's mobile device policies and procedures to safeguard health information. This requires consideration of numerous issues, specifically mobile device management, bring your own device, restrictions on mobile device use, security and configuration settings, misuse of mobile devices, reacquisition of the device after a bad event, and wiping of the devices remotely. Number 5, probably most importantly, training. Conduct mobile device privacy and security awareness and training for all workforce and staff. Safeguards will not protect your patient information unless the workforce is appropriately trained on what they're supposed to do. Privacy and security awareness training should be conducted often and include discussion of things such as risks when using mobile devices, how to secure mobile devices, how to secure information you have downloaded onto the device, how to avoid mistakes when using mobile devices, and how to comply with the organization's mobile device policy that you have created. Relatedly, in 2013, the National Institute of Standards and Technology issued Publication 800-124, which is the guidelines for managing the security of mobile devices in the enterprise. This is a techie document, not so much organizational, but it's helpful. These are best practices that will help ensure the security of your organization. Compliance with these NIST guidance is not mandated by HIPAA, but they do cover similar things. We recommend that you at least review these guidelines and follow them. One thing to be mentioned before I run out of time is that medical apps. So one other thing that we recommend is a policy for reviewing and identifying medical apps that are going to be used on mobile devices. We think you should have a process for reviewing and approving these before you allow physicians to integrate them into their practices. Some claim they're HIPAA compliant, but you should do your own review to determine whether or not they appropriately house PHI. Additionally, some of these apps are designed by third parties. So if they receive, maintain, or transmit PHI, they are a business associate. You need a business associate agreement. Finally, you need to understand which of these apps are regulated by mobile medical device applications under the FDA regulations, and most of these would be patient-centered, but some of them may affect physicians. So, in closing, only 68% of physicians in that HIMSS survey said that their organization had a mobile device policy. If you are in the 32% who do not, or more likely, if you are someone who has not reviewed your policy recently, we recommend that you do in light of the OCR and NIST guidelines. More than a policy, you really need a mobile device management strategy that is flexible enough and not outdated, and that integrates training to your workforce and staff. Thank you.